Hi, this is Bruce Bair from FemaleMenopauseMentors.com, and I'm reviewing an article written by Anne Valancourt entitled Thinking, Aging, and Menopause. Is this normal or do I have dementia? Anne says that by the year 2030, roughly 20% of the American population will be over 65. Now, normal aging of the brain usually involves some gradual structural and functional changes that can result in up to 10% loss of brain volume by the age of 80. This means that the brain itself, the tissues of the brain, shrink, which must mean there's less brain cells. And especially up in the frontal region, which is behind the forehead, which is the boss of the body. It's where the executive function and decision making takes place. When there's a reduction of blood flow and lower levels of neurotransmitters, which are used for brain cells to communicate. There are more senile plaques and neurofibrillatory tangles. Obviously, plaques and tangles aren't something we want amongst our brain cells. And sometimes you can have these things, they don't bother you, but sometimes they are associated with Alzheimer's disease. Now, on the positive side, there's evidence that the adult brain is resilient and able to undergo cortical remodeling. The cortex is the area where thinking takes place and memory is stored. And this ability of the brain to do this is called brain plasticity, and it refers to the brain's ability to adapt and change as it ages. All right, now cognitive health, thinking ability, is measured by the quality of 9 elements, which include language, thought, memory, executive function, that's decision making, perception, judgment, attention, remembered skills like driving, and the ability to live a purposeful life. In addition to cognitive health, emotional health is associated with aging changes is also considered when observing total brain function. Now, you measure emotional health by the number of psychiatric issues you have. So if you're depressed and anxious, uh, those mean your emotional health's not as good as when you don't. And what's your ability to emotionally adapt to life situations? Those two things are what make up your emotional health. For women, there's a lifetime risk of depression of roughly 35%, which is twice the total uh, risk for men and women. So men have a much lesser chance of becoming depressed than women do, and this is thought to occur somewhat due to the hormonal swings, especially during menopause. 37% of women who develop schizophrenia, over 1/3, do it after the age of 45. Now, how do we decide if we or a loved one has a problem? Well, if we have it, we probably won't decide. But how do our loved ones decide if we have it, or how do we decide if a loved one has it? Well, MCI, or mild cognitive impairment, is defined as an impairment of memory that is evident to others, although the individual can still perform most activities of daily living. Now, we see that a lot. I see my friends who now run the checkbooks for their mothers. She can still take care of herself within her own home. Sometimes they don't drive anymore, but they still clean their house, know their favorite shows, can fix themselves a meal, and can appropriately bathe themselves and get dressed without a terrible risk of falling. Okay. Up to 22% of people over 71 will have MCI without developing full dementia. So about 1 in 5, okay, will have MCI. Now, dementia is a cognitive deficit, meaning a thinking problem, a big one, which includes memory impairment and at least one other cognitive problem with the 9 elements listed above. Alzheimer's disease is the most common form of dementia, and with Alzheimer's disease, you see memory loss, damage to brain cells, and deteriorating function in daily life. Developing dementia is a risk factor which is almost out of our control. And our mental health is, it's equally important to physical health. You need to take a look at what you can do to help yourself by reading the rest of this article and then implementing some of the suggestions that Anne makes. This is Bruce Bair of FemaleMenopauseMentors.com.